In recent months, Peter Obi has continued what many now describe as a silent revolution. One that's not happening in political rallies or campaign grounds, but in hospitals, health centers, and training institutions across Nigeria. His latest stop was in Enugu State, where he visited a nursing school and donated 20 million naira to support their infrastructure and training needs. But this is not an isolated gesture. It's part of a consistent pattern, a reflection of the values and vision of a man who believes that investing in people is the highest form of nation building. Over the past year alone, Obi has quietly visited dozens of health institutions across the country, from teaching hospitals to mission-owned medical centers and nursing schools. Each visit tells the similar story, an encounter with hard-working health professionals struggling to serve despite limited facilities, outdated equipment, and near non-existent government support. Yet Obi never just shows up for the cameras. He comes bearing practical support, financial donations, medical supplies, and more importantly, a message of hope that Nigeria can indeed build a healthcare system that works. When Peter Obi donates, he doesn't just give money, he makes a statement. He reminds us that good governance is not about noise or showmanship. It's about impact. It's about leaders recognizing the critical role of nurses, doctors, and caregivers, the people who hold our healthcare system together, even in its most fragile state. Take, for example, his visits to health facilities in Anambra, where he interacted directly with students of nursing, medical laboratory science, and community health programs. He would always emphasize one simple message: a healthy nation is a wealthy nation. He sees healthcare not as a cost, but as an investment in human capital, in productivity, and in the future of the country. Let's be honest. Nigeria's healthcare system is in crisis. Our hospitals are underfunded, our health workers underpaid, and our medical facilities are in deplorable condition. Thousands of Nigerian doctors and nurses continue to leave the country in search of better working conditions abroad. A situation we now call the Japa syndrome. Peter Obi has never shied away from speaking about this. He understands that the problem cannot be solved by mere policy statements, but by changing how the government prioritizes spending. During his tenure as governor of Anambra State, he demonstrated what's possible. He invested heavily in health and education, not just by throwing money around, but by ensuring accountability and sustainability. Under his leadership, several mission-owned hospitals were revitalized. He reintroduced a model of partnership between government and faith-based organizations, leveraging their efficiency and reach to improve healthcare delivery. And he also prioritized primary healthcare centers in rural communities, ensuring that even the poorest families had access to basic medical care. And it worked. By the time he left office, Anambra had one of the lowest infant mortality rates in the southeast and one of the highest immunization coverage rates nationwide. So when Obi visits a nursing school in Enugu or a hospital in Nasarawa, he's not doing it for publicity. He's doing it to highlight a philosophy that no nation can rise above the quality of its healthcare system. He understands that the nurses we train today are the backbone of the health system tomorrow. He knows that when a country invests in preventative care, maternal health, and community medicine, it saves billions in avoidable costs. Imagine a Nigeria under a Peter Obi presidency. A Nigeria where every child has access to quality health care, not because their parents are rich, but because the system works. A Nigeria where doctors no longer need to flee abroad because hospitals are well equipped, salaries are fair, and merit is rewarded. A Nigeria where healthcare is data-driven, where we use technology to monitor disease outbreaks, track immunization, and improve emergency response. This vision is not a dream. It's practical, it's achievable, and most importantly, it's consistent with Obi's record. He's done it before, and he can do it again on a national scale. What makes Obi stand out is his humility and consistency. He doesn't wait for election season to show compassion. He doesn't need a convoy of 100 vehicles to prove he's a leader. He simply shows up, quietly, directly, and purposefully. In a time when many politicians measure success by how loud their supporters cheer, Obi measures success by impact. How many lives are touched? How many hospitals are improved? How many young health workers feel motivated again? His visits have also reawakened a sense of responsibility among Nigerians. More people are now realizing that the power to change the system isn't limited to those in office. We can all contribute in our own way. Through his example, Obi is reminding us that leadership is service, not entitlement. The 20 million Naira donation to the Enugu nursing school may look small in the eyes of politicians who waste billions on political jamborees. But for the students and staff of that institution, it's a lifeline. Money that can renovate classrooms, improve hostels, buy training equipment, or support indigent students. It's the kind of impact that keeps hope alive. It tells those students that someone out there believes in their future, that their efforts matter, and that Nigeria still has leaders who care. If Peter Obi becomes president, his approach to healthcare will likely follow the same model that has defined his career: transparency, efficiency, and human-centered planning. He will prioritize primary healthcare, ensuring that every community has at least one functioning health center. He will improve health worker welfare, reducing the exodus of skilled professionals. He will promote public-private partnerships, encouraging investment in hospitals, research, and medical training. And above all, he will ensure that every Naira budgeted for health truly reaches the people. Under his leadership, Nigeria can move from being a country that exports its doctors to one that attracts medical tourism. We can move from a nation where people die from preventable diseases to one where every life is valued and protected. So, as Peter Obi continues his quiet tour of hospitals and health institutions, Nigerians are taking note. They see a man who walks the talk, a man who gives without boasting, and a leader who understands that true power lies not in how many people you control, but in how many lives you touch. Because at the end of the day, leadership is not about occupying an office. It's about leaving people better than you found them. Peter Obi's actions remind us that hope is not lost, that Nigeria can still be healed. One hospital, one school, one leader, and one act of compassion at a time.